Okay, there we go. Great. Well, thank you so much for being here today. This is our it's now June Food Assistance Provider Call. My name is Julia Grenfelt. I'm a program manager with the Prince George's County Food Equity Council, which is incubated by the Institute for Public Health Innovation, which is our home nonprofit. And I'm here with my colleague, Heaven Jordan, who's helping with some facilitation, helping with notes, and will be helping with the chat as well. So I think I probably know a lot of you, but if you're new to these calls are a monthly call series where we bring together folks in the food assistance provider space, but that's a pretty kind of loose and broad term. It's really just kind of organizations in the social service space, a lot of which are doing food assistance and distribution. So really, it's just an opportunity to bring everyone together into the Zoom room every month to connect, to share resources, to hear about what you're doing, hear about what your challenges are, and kind of figure out strategies to work together to address food insecurity and help you all do the incredible work that you are doing. So this is our June Food Assistance Provider Call, and we're focusing today's call on mental health resources as well as other kind of health resources available through health clinics and federally qualified health centers in Prince George's County. So we have a robust lineup of speakers today, so I'm going to keep this introduction relatively short so we can jump into hearing from our speakers. And I dropped the agenda in the chat, so if anyone wants to take a look at what we're going to be diving into today, please do pull that up, and Heaven, if you wouldn't mind just dropping that in again so folks can check that out. Okay, and if you're just joining us and missed this before, please do use the chat to introduce yourself so we know who's here today. Before I jump into introducing our speakers, I just wanted to share a brief announcement that our July call is going to be a little bit different. Normally, we host these calls on the first Thursday of the month from 1 to 2 p.m. Our July call will be a special collaborative call with our friends at the Montgomery County Food Council. So we're going to actually be hosting the call instead during their usual call time. So that will be July 10th from 1 to 2:30 p.m. So there's a registration link. It's a different registration link. So I'm going to drop that in the chat now. If anyone wants to just go ahead and sign up for that July call, you can do so. We're also going to be sending out this information via email. We'll cancel our standing July call invitation calendar invite. So you'll have all this information later, but I just wanted to bring this up at the beginning of the call in case any folks have to jump off early, so you know that there's a change to our July call schedule. Again, we'll send out all that information a little bit closer to the date. Okay, so with that, I'm going to jump into our series of speakers. Again, we have a lot of great folks here that are going to share resources and information with you all. So we're just going to jump through these. Again, apologies if I have to cut you off short. We're going to try to keep it pretty brief for each presentation. So try to keep it within about 5 minutes so we can be sure we can hear from everyone. So I'll go ahead and introduce the first speaker. We'll have a couple minutes for questions after that speaker, and then I'll jump into introducing the next speaker after that. So our first speaker, we're going to have Brittany Vasquez. Hopefully I pronounced your name right, and apologies if I didn't, from the Prince George's County Department of from the Prince George's County Health Department Behavioral Health Division. So Brittany, I'll pass it to you for your presentation.
Is it okay if I share my screen?
Yep, go for it. Let me just make sure you have privileges, but you should. Yep, you should be able to, so go ahead and try.
So good afternoon, everyone. My name is Brittany Vasquez, and I'm from the Prince George's County Health Department, Behavioral Health Services. So I'm going to talk about some of the behavioral health services available to our residents here, which is so important because more than 1 in every 5 U.S. citizens or people in the U.S. live with mental illness. So 988 is the national number for behavioral health emergencies. Callers can connect with mental health professionals. They can request a mobile response team, and callers can also connect to Veteran Crisis Lifeline for support by pressing 1 after dialing. So speaking of that mobile response team, the county provides teams that are available to go to the location of the crisis, assess the situation, and offer the most appropriate clinical intervention. iMind Behavioral Health is the county's vendor for this service, and they're available 24/7. Prince George's County residents may request the MRT when calling 988, and the teams are comprised of a behavioral health clinician and a peer. And it's beneficial to have a peer because this is someone who may share similar experiences to the client, and it can make the situation and accepting services a bit more comfortable. The local behavioral health authority is responsible for planning, managing, and monitoring the public behavioral health system in Prince George's County. So the public behavioral health system being those providers who are funded by the state or accept Medicaid. They assist county residents in seeking information and referrals for various services, including residential rehabilitation programs for persons with mental illness. They can assist with any complaints. So if you have a complaint about a provider, let's say you called 988, requested MRT, and they never showed up, you can make that complaint to the local behavioral health authority so they can address it and rectify the issue. The Langley Park Multi-Service Center has bilingual staff that assist the community with DSS entitlements, SNAP benefits, temporary cash assistance, referrals to family law attorneys, referrals to Family Crisis Center for domestic violence, counseling services, substance abuse services, and help with enrolling in health insurance. And it's really important that they have the bilingual staff so that they can embrace the Spanish-speaking community in Prince George's County. The Bridge Center at Adams House provides clinical case management services for returning citizens and other individuals who are criminal justice involved, veterans, transitional aged youth. They also have peer support services for returning citizens who have a history of substance use. They also have support for people who need assistance with child support, filling out paperwork, understanding the system. And below are just some of the many services offered at the Bridge Center, and they're all offered at this one place, so it doesn't deter people from getting services because they have to go to a bunch of different places to get what they need. The Northern Region Addictions Medication-Assisted Treatment Clinic provides methadone, individual and group counseling, case management, peer support services, and Narcan training so that people could learn to reverse an opioid overdose with a free virtual naloxone training and get a kit as well. Because in 2020, it was reported that 82.3% of overdose deaths were caused by opioids. So this free training can help people potentially save a life. We also have some youth-specific services. The Adolescent Recovery Clubhouse provides activities designed to help at-risk youth develop and maintain healthy lifestyles. And they also provide services for the youth's family as well, so that they can better communicate with their parents and their parents can better communicate with them and really grow a stronger bond in the family. Bridges to Success is for youth. They provide community-based support services for juvenile offenders referred by the Department of Juvenile Services, and they connect clients to community services and resources as well as referrals for training and employment. Are there any questions? I'm going to stop sharing so I could see you guys in case there are.
Thank you so much, Brittany. Any questions?
Of course.
Well, we have about 1 minute before we're going to jump over to our next presenter.
Yeah, Brittany, can you share your email address, please?
Oh, yes, I will put it in the chat for you right now.
Thank you.
Great, thank you so much. And I see that there's a question in the chat about getting the PowerPoint slides. Yes, we can share hopefully all of the slides that are presented today. If anyone does not want to share if you are presenting slides and don't want to share your slides, please just let me know offline. But I'll assume that anyone sharing slides, it's okay to share those out. Okay, great. Well, if you think of anything later, feel free to drop any questions for Brittany in the chat, but we're going to keep moving on. So our next presenter is Florence Nelson from the National Alliance on Mental Illness. So Florence, the floor is yours.
Everyone, my name is Florence Nelson. I'm the program coordinator for the local affiliate of the National Alliance of Mental Illness. It is the PG chapter that I'm the program coordinator for. I don't have a slide presentation for you, but I did prepare to provide a presentation for you and give you some brief notes on our organization and what we provide in our services. So who we are the National Alliance on Mental Illness, and we are an affiliate chapter of the national organization. It is a national organization, extensive organization, and it's very involved, and it's a nonprofit, and we're dedicated to helping and building better lives for people and families affected by mental illness. So if you see me read down, it's because I'm looking at my notes to make sure that I get everything right and provide you with the information necessary for this presentation. So just briefly, what we do and our goals: we empower persons and people with mental illness and their families through support, education, and advocacy. We increase awareness in the community about mental illness. We advocate for better partnerships. We advocate for better mental health care, treatment, and services. We develop community partnerships to support our local chapter, PG chapter, and we increase membership to expand our reach in the community. So there's a great deal of community outreach that we provide for individuals, and that we try to help and reach individuals that are experiencing mental health problems and mental health issues. Education and advocacy: we train volunteers to bring peer-led programs to the community, and these programs provide free education, skills, extensive training, and support. So that's what we do as far as education and advocacy. That is the biggest component of the National Alliance for Mental Illness. That is what we primarily do. And we help try to get individuals connected to resources that are out in the community and that are out that they may not be aware of, so that they can so that they can live comfortably with the issues that they're dealing with and get help for them. Okay, so we also have our signature programs. And so our signature programs for our local chapter. So what we do is we have family to family, and these are support groups, and it's free for individuals that need help and assistance. They're free, but we also train facilitators and train volunteers to lead them. They're the peers. So these are our programs. So it's family to family. So it's free 12-class courses for family caregivers of individuals with mental illness. Family support groups, which are free support groups for families, caregivers, and other individuals for mental illness. We have peer-to-peer free courses consisting of 8 two-hour classes taught by a team of trained mentors experienced at living with mental illness. And the classes for persons with serious mental illness interested in establishing and maintaining their wellness and recovery. NAMI Connection Recovery Support Group. So these, I'm just going over some of the support groups that our organization offer and what we provide as our key signature programs for our local chapter. NAMI Homefront, which focuses on the unique needs of military and veterans with mental illness by encouraging their family members to understand and support them while maintaining their own well-being. NAMI Basics, which is a 6-session education program for parents, caregivers, and other families who provide care to youth 22 and under experiencing mental health symptoms. And then we have In Our Own Voice, which is trained persons that give presentations about living with mental illness. So that is, in a nutshell, what our organization is about. Those are our key signature programs, and that's what we do for, that's what we offer as the local chapter for the National Alliance of Mental Illness. And I can also provide our website in the chat.
Thank you so much, Florence.
Yes.
How can folks sign up for those programs? Is it through the website?
Yes, it's through the website, and also we do a great deal of community outreach. So if you see us at different events, you can sign up and we can connect with you individually, but primarily the best thing is to go to our website, which I'll provide in the chat, namipgc.org, and that'll take you right to our website, and you can go, it'll lead you to our support groups and some of the different resources that we offer that volunteers or individuals that who want to get involved can get involved.
Great. Thank you so much for sharing. Does anyone have any questions for Florence before we move on? So I see one question in the chat. Do you provide trainings for trauma-informed / mental health centered approaches to food assistance providers or organizations?
So we do not do that. That's not something that we do. We provide training for individuals to primarily lead peer-to-peer support groups, and also training to individuals that are wanting to get involved in the community, specifically as it relates to family and individuals and youth with mental illness. But we don't do that necessarily, but we can provide you with resources and let you know where you can go if that's something that you want to do. Because we're education and information. That's what we do. We connect everything and everybody. But we're also a source of comfort for people who have those issues.
Got it. Thank you so much for explaining that and for all of the work that you do.
Thank you.
Okay, we're gonna continue moving on, but I really appreciate you sharing all this information, Florence. If anyone has any questions for Florence after we move on, please feel free to continue using the chat to ask those. So our next presenter is Kayla Hughes, who's with the Community Engagement and Consultation Group. And so Kayla, I will pass it to you to share your presentation.
Thank you so much. Thank you. Let me go ahead and share my screen. Give me 1 second. One second. I'm sorry. There we go. I'm so sorry. I had it ready and it just was not ready. Here we go. All right. Can you see my screen?
Yep.
Perfect. So we are Community Engagement and Consultation Group. I'm Kayla Hughes. I'm the office manager here. Just to get started, who we were established in 2017. I'll be brief with this section. Just wanted to briefly talk about our mission, which is to bridge gaps and create workable solutions toward health equity. Our vision to be a trusted leader in the community engagement and improve access to essential resources. Where we serve Montgomery County, Prince George's County, Frederick, and Howard County. So we have some internal languages that we speak. We speak French, Spanish, Amharic, Swahili, Turkish, Pashto, Dari, and Farsi, African Pidgin, and Haitian Creole, and American Sign Language. Our programs, we have the Community Resource Education Programs, known as CREP, educational information classes. We have live discussions, seminars, and webinars. We also do outreach. We normally do it in our local libraries, both in Montgomery County and Prince George's County. We do targeted case management, and we also provide referrals to our partners. We offer SNAP, the wraparound, SNAP formerly known as food stamps. We provide eligibility presentations to clients to find out if they're eligible for SNAP. We do enrollments. We help people through the application process. We do redetermination, helping people find out if they will redetermine if they still qualify. And then we recently do SNAP EBT fraud reimbursement, as there was fraud going around. So we do help clients get reimbursed for the money that was stolen off of their EBT cards. More programs that we do have, we have the Workforce Training, Employment Placement, and Economic Stability, our WE program. We address social determinants of health through career pathways. We have employability skills training. We have partnered with LinkedIn Learning to provide an online platform of classes available to anyone who would like to upskill or reskill and learn new trades or something they want to add to their resume, another certificate if they want to. We're starting up in July 2023, and it's a 3-month duration class. It will end in September 2023. The class that we're offering is Advance Your Skills as an IT Help Desk Specialist. In addition to the IT class that we are providing, we also have English for non-native speakers. It's an ongoing class that we will have starting in July. We provide career counseling, resume writing, interview skills, and workplace etiquette. We also provide targeted case management, needs assessment, career readiness, social services such as food assistance, access to healthcare, behavioral health, and all along with referrals. We also have partners that we refer clients to who do not have access to certain services. We also have our supportive services, our home-to-home, a fresh start on demand. We have the initiative of a community closet. We provide men, women's, and children's clothing, kitchenware, beddings, and linens, and children's books, free to anybody that needs any of these items completely free, located in our Beltsville office in Maryland. And then we also have the Emerging Public Health Workforce Initiative. We also have student ambassadors that are on with us, continuously learning about public health and about being a community health worker. That was a very brief description of what we do. I try to make it as brief as possible. If you have any questions, please let me know.
Super speedy. Thank you so much. Any questions for Kayla? I see one in the chat asking about whether you guys serve undocumented immigrants.
Yes, we do. The only thing that we cannot provide would be the food assistance for SNAP. You have to be either a U.S. citizen or in the process of being a U.S. citizen or have some type of documentation. But all of our other services we can service undocumented.
Great, thank you so much. And then another question, do clients need to qualify to be assisted? So kind of any eligibility criteria to
eligibility for SNAP, yes, there is a certain criteria. It would be income, depending on how your household is, but it also depends on how many expenses that you have. So it's a really, it depends on the specific case and the specific person. I also saw another question about where we're located. Our office is located in Beltsville, Maryland.
All right. So in addition to what Kayla just said, as far as eligibility is concerned, because we are partnered up with LinkedIn Learning, which is a grant-funded program through the Maryland Department of Health. You know, folks who come into that training, they have to be authorized to work in the United States because the goal is to have people employed, and because we have deliverables to meet. And also, secondly, we also try to help them through the legalization process, which is working with pro bono legal services. So, visas are different, authorizations are from A to Z. So we can navigate through that.
Anything else? Oh, I see one more question in the chat. How do you connect clients to give SNAP presentations? So specifically, I guess referring to kind of SNAP, how do you do your SNAP outreach? Is that the question?
Yeah, sure. So we have a flyer that's available. We pass out everywhere. I can also provide my our email address in the chat, but we do let people come to our office location in Beltsville. We also go to your local library, depending on what city you're in, we'll travel to you. And we can also do it over Zoom if you choose to do that as well. So we're pretty flexible with doing SNAP applications and eligibility presentations as well.
Awesome, thank you. Okay, going once, going twice. And Kayla, if you wouldn't just mind dropping the name of your organization and maybe any contact information in the chat, that would be great. Okay,
Sure,
thank you so much, Kayla and Dr. Anita, for joining and presenting the information about all the great work that you're doing. Okay, so we're going to be moving on. I see there are a few more questions in the chat, but Kayla, maybe you can address those via the chat just so we can continue moving on. Okay, the next speaker, I'm not sure if they were able to join because I know they had some conflicts. So I just want to see if anyone from CCI Health and Wellness is on, or if we should just move on to the next presentation. Okay. I think they had a conflict, so hopefully we'll get their information from them and we can share that out via the notes. So instead, I'm going to jump over to the next speaker, the folks from Prevention Link. So we have Princess Clark and Tornisha Stokes talking about the Prevention Link program and the services that you provide. So hopefully you guys are ready to jump in.
Yes, can I share my screen?
Go for it.
Okay, we're with Prince George's County Health Department. We're a Prevention Link project, and Prevention Link project is basically a 5-year CDC agreement that we received from CDC that was awarded to Prince George's County. It was a $12.4 million grant over 5 years. We serve not just Prince George's County, but it's 4 counties total, which includes St. Mary's, Charles, and Cabot County. Also, one of the main goals is to improve health outcomes for adults who's either is diagnosed with type 2 diabetes, have had a heart event, cardiovascular event, within the last year, and also who has hypertension or high cholesterol. We offer several different services. It doesn't matter what type of insurance. If you have insurance, I do not have insurance. And we use the latest technologies to assist with these services. So to jump right into to explain what services we offer medication diabetes prevention program, the MTM program, cardiac rehab, diabetes self-management, and remote patient monitoring. So with the National Diabetes Prevention Program, it's a 26 weeks program, and it's for people who is a pre-diabetic, and we have trained lifestyle coaches to teach this approved CDC curriculum. And basically it just teaches you how to eat healthy, the exercise, what type of exercise to do properly. They have like virtual grocery shopping sessions, so different activities just to have people engage and to show them how to manage their weight and how to eat healthy. With the medication therapy management program, we partner with University of Maryland School of Pharmacists. So we have advanced pharmacists who works with the providers within the Prevention Link program. So let me just go back a little bit. So we have 37 practices that's part of the Prevention Link program and 16 diabetes prevention organizations that is part of Prevention Link. And so with the medication therapy management program, our pharmacist works with the practice and to review those patients that either have hypertension or had a cardiovascular event within the last year, either diabetics, just to review their medication to make sure they're adherent, that they're taking their medicines. If there's issue with getting their medicines, they connect them with community pharmacists so that the medication can be delivered. They even help people who have issues reminding to take their medication. They provide like bubble wraps and separate their medicines by the day. They also, if there needs to be clinical interventions and recommendations where they need to have a medication change or a change of dosage, they work with the providers to provide that information. We also offer cardiac rehab program, and that's for anyone who had any cardiovascular event within the last year, at least age 18 years or older. They work with the training rehabilitations to do exercise sessions, educational sessions, and that program is 36 weeks. But the other two programs, the DPP and the medication therapy management programs, are free. There's no cost. The cardiac rehab, it could be a cost. It depends on the type of insurance that the patient has. The diabetes self-management education and support services, this program is for people who is a type 2 diabetic. And this program is 10-week sessions. This program is virtually where you work with a trained lifestyle specialist coach as well to basically to learn how to manage your diabetes. The remote patient monitoring program, we're partnered with iHealth, and they offer devices. There's no cost to the patients where you connect to a mobile app, and your provider also connects to that mobile app where you're managing your hypertension, your cholesterol on a daily basis or weekly basis, just to make sure that it's not high, low, you in range, and you can interact with the provider virtually by using that app. And also the medication therapy management pharmacist also has access to the app. So they're checking daily to make sure that the patients is monitoring their blood pressure. If there's any alerts, they are noted. And so they can provide intervention immediately. We also work with community health workers. We have community health workers within the health department, and we also partner with other organizations to make sure that the residents can have access to these services so that if there's any social determinants of health barriers, they can help identify what they are and then provide resources so that they're not affecting them to get the services that's needed. It could be from transportation, access to food pantries, access to because they don't have, let's say, a daycare provider. So anything that affects them receiving healthcare services, their CHWs are there to help. And also, in regards to the referrals, getting the referrals for these different programs, we work with CHRIS, the Bidirectional Public Health Information Exchange System. That's the CHRIS is the lead for the county for Maryland. And so we partner with them where we can actually have that bi-directional referral and the closed loop communication with the providers. So if any of their patients enter into these programs, they will know what program, if they're attending the sessions, if they're missing the sessions, if they're out, if their health measures are improving or not. And also the whole care coordination team can see the information as a need, as needs basis and provide that communication. And so what we do, there's 3 primary focus areas. The primary care providers, as I mentioned, we have 37 practices throughout the 4 counties. That's part of Prevention Link. We focus on the practices and prevention and self-management programs. So regarding the primary care providers, we offer that referral management service, like I just mentioned, using the CRIS system. We also have community or practice meetings every quarter where we pull together the practices and lifestyle coaches to talk about best practices, lessons learned. We have staff training for the lifestyle coaches. So we offer advanced training for those coaches. We also focus on quality improvement. We partner with HQI to make sure we work in with the practice. They perform practice transformation services to the providers to make sure that they're meeting their measures if it's related to diabetes, hypertension, or cardiovascular disease. And also, we just make sure that we're in line and their workflow. We don't want to interfere with their workflow, but just enhance the workflow. So we partner with them to go over workflow to see what works best for them and to make sure we meet in the performance measures of the grant as well. And so again, with the patients, we have the community health worker services, which, we want to have the wraparound services to migrate any social determinants of health barriers. They do the initial, SDOH assessment. We have initial one and a very detailed one, similar to Prepare. Also, we just want to make sure, again, that there's no barriers from the residents getting the services that we have to offer. And also Prevention Link focus on sustainability because, again, I said it was a 5-year grant. So we don't want these services to disappear once the grant is over. So we also working on teaching the providers, the practices. Okay, once prevention is over, these people still need, the residents still needs the resources. And so what does that look like? How can we make these programs sustainable? And so again, we mentioned the training and also providing that technical assistance and technical support. So, any questions for me?
Thank you so much. Any questions? Quiet group today. Going once, going twice. And I might have missed this. I just have a question. So if folks on this call want to refer maybe their clients to the Prevention Link programs, how can they what's the process to do that?
Yes, on our website, there's a participant interest form. And Princess, would you like to provide more information?
I wanted to go ahead and add to that. So there's several ways that you can reach out to us. The easiest way is to complete a participation interest form. It's on our website. That's, if you know someone who is living with chronic disease or at risk for chronic disease, have questions, regarding the medicine that they're taking. If you take multiple medicines or start a new medicine, helping you to get to that therapeutic level, that's important. Or interested in losing a few pounds. We have a lot of different services for that. So they can either call the number that's on our website, we'll also list it here, send us an email or fill out that. For organizations listed here, one of our goals and strategies that's been very successful is to partnering with other community-based organizations. And in doing so, we've worked with a couple of organizations who use food as medicine, and we'll have health screenings where we've gone out and we've offered blood pressure readings and diabetes screening. And one of our most recent when we were able to identify an attendee who was absolutely having a hypertensive urgency, and we were able to provide her with the help that she needs. So some people that we found who are food insecure have medical issues going on, and they aren't able to, see a doctor, have a regular doctor. Prevention Link links them to those services. We have doctors on board who offer free or low cost services. We have health qualified physicians, and we're able to connect residents to those services and provide them with the help they need. Just because you're food insecure, you don't have to, be dealing with health issues as well. We want to really help our residents get healthy and well fully. And that's, addressing any type of health or medical problems, So food insecure is one thing, and we address the other thing, and we want to work together with you. If you like to work together, I'll put my email in the chat. I run write an article called Prevention Link Magazine, Prevention Link Magazine, that we can offer and elevate your services. You can partner with us. Again, we're happy to join any type of community event or things that you're having, put it on our calendar, and really help provide additional services for the people who come to your programs and want help.
Great, thank you so much, Princess. I see that there is a question in the chat about age eligibility. So folks in Prevention Link need to be at least 18 years old. Carla, I'm going to pass it to you to ask your question. We have 30 seconds, and then we need to jump over to the next presenter. So if you can be really quick, I'd appreciate it.
Okay, I just had a question. Since you all started this program, do you all have a high enrollment? And also, do you all work with the healthcare companies' case managers?
We do have a high enrollment. We actually started getting referrals in year 3. It was a total of 80, and as of today, we have over 1,100 referrals. And what was the organization, I'm sorry, that you asked that we work with?
Do you all partner with the healthcare organizations' case managers who manage those clients with those type comorbidities?
We can, but currently we, like those CHWs, when we realized that they did have a healthcare manager, the CHWs did not follow up that patient because they had a healthcare manager. But we can, but currently we don't. We usually just work with the provider and our CHWs and the pharmacist.
Yeah, I want to add our next step, Prevention Link Impact. We'll be working more closely with insurers. So developing those relationships so that door is not shut, it is open to delve deeper and to partner with them.
Thank you so much. Okay, so we're going to be moving on to our next presentation. So we're going to be hearing from La Clínica del Pueblo. And Rosalind, are you going to be presenting along with Tanya or just Rosalind?
Yeah, we're going to be presenting. I can share my screen, and
Okay.
if someone can just confirm if you guys see it for me, please.
Sounds good. Pass it over to you then.
Can you guys see the PowerPoint?
Yes.
Thank you.
Hi, everyone, and thank you, Rosalind and Julia, for the invitation. It is really, it's really good for us to be in these spaces and just talk about La Clínica and the services we provide. So my name is Tania Ruiz, and I'm the Health Promotion Manager at La Clínica, and with me is Rosalind Trujillo, which is Health Promotion Senior Program Coordinator. Go, Rosalind. So just a really quick overview of La Clínica. We are a federally qualified health center and a patient-centered medical home, as well as a community-based organization. And La Clínica actually is turning 40 years this year, and it was opened by Salvadorian immigrants and U.S. healthcare advocates in response for the emergent health needs of the displaced migrants and huge migration waves that happened in the 80s. So mostly of these migrants came from Guatemala, Honduras, and El Salvador. Today, mainly we serve the Latino immigrant community in the DMV. So currently we have 3 sites. We have 2 clinical sites, one in DC in 15th Street, close to Columbia Heights in DC, and we have one in PG County. Next. And we have a community-based community-based center that is in Mount Pleasant, DC. So a little bit of the clients' demographics. As I mentioned, most of our clients are Latino. 80% are immigrants, which come mainly from Central America, from the Northern Triangle that includes El Salvador, Honduras, and Guatemala. 35% of our clients are actually uninsured, and the biggest number of uninsured clients we have in compared to DC and Maryland, it's in Maryland in PG County. Most of our clients feel more comfortable communicating in Spanish, and also most of them are below the 200% of the federally poverty line. So this is mainly the clients we serve at La Clínica. Next, Rosie. For us, we try to provide integrated approach, and what we try or we strive to do is that most of our services are connected, and basically each client or community members receives depending on the needs they have. We look carefully to the social determinants of health, and we provide navigations, as well as we're connected with the primary medical care and the doctors, but we're also, if we see that a clients need mental health support, we can refer them internally. So what we try to do is to provide an integrated approach to our services. And for example, we try to directly address all the challenges that we see in our patient population. So in a visit to our medical center, they can see a provider, they can go to a therapy session, and they can have an educational session with one of our health educators about nutrition. So that's what we try to do at La Clínica. A little bit of the context of and the barriers we see in our clients, of course, is a financial, and we see that this actually increased after COVID. Language, most of our clients speak Spanish. A lot, also we have a lot of like cultural things that are positive, but some are negative, such as machismo or stigma. And huge barrier that our community has is the migration status. So much of the services, or many of the services, are only for U.S. citizens or those folks that have residents. So it is really hard for us to find services sometimes for our clients if they don't have a status. Also, the healthcare system compared to the one we have back in our countries is totally different as the one we have here in the US. So for our clients, it is really complex to navigate it and understand it, as well as the lack of health insurance is a major barrier to care for our Latinx community in the DMV. So some of the services we have, of course, we have primary care access, but talking specifically to the health promotion program, we try to understand the context of our clients, and we work a lot around chronic disease prevention and management. So this includes diabetes prevention. We have the diabetes prevention programs, we have the diabetes management programs, but we also have a huge component of navigation services. So after COVID started, like we saw that there was like a huge need for access to food. And what we try to do is to create that navigate our clients to access not only food but also healthy food. So that's why we were able to tailor our programs with the community needs. We also try to find funding sources to pay for all of this. And we created innovative partnerships outside of the medical field or community field. For example, Fresh Farm or PG Fresh or other resources that like they're not linked to healthcare, but we know they have a huge impact in the health of our community. So that's why overall, we try to understand the context of our clients and try to go beyond by navigating to them to those services that they need. They have also all the attention in Spanish by our health educators and navigators. And when we do navigations to food access or other services in the area, they are accompanied by health promoters that also speak Spanish and are trained by us. So Rosalind is going to talk a little bit more about the, it's me, right, Rosalind? Or you're next?
I don't know if you wanted to talk about the key challenges and then I can talk about the food distribution.
Talking about our food access and food distribution efforts we do at La Clinica, currently we are distributing in a monthly basis to our clients that are part of either a diabetes prevention program or a diabetes management program. We are providing these services. But some of the main challenges we have seen since we started doing this is, of course, inflation. Prices are going up, so of course prices for us are going up, but the the bags are not getting bigger, so that's a big problem. And also it is really hard for our community to like buy or purchase healthy foods right now because everything is so expensive. Also, we received a lot of COVID funds that helped us, provide the services. And now that the COVID emergency has ended, it has been really, it has been difficult to find new funding sources. Also, data management and really track the impact of this is a challenge we have seen. Lack of transportation to receive either tokens or food bags. It has been hard for our clients. Since we provide not like canned items, but we provide a fresh produce, many of our items are perishable, so we're unable to offer like more distribution dates and be more flexible on that. And there are a lack of resources in the Spanish in the area, so that's a huge challenge for us. And Rosie, I think you have like 1 minute.
Sorry, I'll try to rush through it. Tanya kind of mentioned it, but basically, so you guys can know how does our food distribution work. We receive the produce bags from our partner, Fresh Farm, like Tanya said, on a monthly basis to our DC. I think it's La Casa, that's what it's called in the Mount Pleasant area. That's where we distribute the bags in DC and at our clinical site in Maryland, Hyattsville, Maryland. Each client is provided with a bag of produce. As you guys can see in the pictures, it's fruits and vegetables, along with a recipe based on the bag content and educational material. And what Tanya was mentioning about the key challenges is because we offer a pre and post survey when the client comes to pick up the bag, to where we assess basically behavioral change. Has the food consumption changed? Food insecurity, has this bag helped both the client and their household in terms of food insecurity? And we do this with our health promoters. And we wanted to share a few small phrases from our clients. So this one says the $30 tokens helped us to buy the eggs for the month, which we know at some point this year there was a shortage of eggs and they were super, super expensive. The other one says the tokens are very useful to us because I am retired. And with that, I can buy the necessary things for my household. Thank you very much. And if there are more programs like this, please sign me up. And then I'll summarize this testimonial where basically we had a client who was part of the diabetes prevention program who received her organic produce. And basically she was too, I guess, shy to tell us that she didn't want the bag because there were certain vegetables that she didn't like. But what she would do is she didn't let us know. She would take the bag to her mom. Her mom would prepare based on the contents that were like prepare meals based on the contents that were in the bag. And I think one day when she went to drop off the bag to her mom told her like stay for dinner, and her kids and her ate mushrooms for the first time, and they really, really enjoyed it. And I think now one of her daughter, I believe, told her like you should put the lettuce stalks in a wide mouth bottle and leave them for a few days before like planting them in a pot. And now she shared with us that she's super happy because now she has lettuce growing on the windows of her apartment where she lives, and that organic fruit and vegetables are very expensive, and she's not in a good financial position to buy them. So these produce bags definitely help. And that is the end of our presentation.
Thank you both so much. I really appreciate it. And I love hearing these small snippets of the experiences from your participants. So really appreciate it. We're running a little bit behind on time, so I'm going to skip over, apologies, but I'm going to skip over questions. If you have questions for Tanya or Rosalind, please just drop those in the chat, and you guys can address them kind of as we move on to our next speakers. So I know we only have about 7 minutes left of the call, and I want to be sure everyone has time to present. So up next, we have some folks from WellPoint. So we have Tiana Mans, we have Lori Hammond, and we have Shakara Kernsong, who are going to be presenting on WellPoint. So I'll pass it over to you all for your presentation.
Hi, thanks. I'm Tiana Mans. I am the Health Equity Director at WellPoint. WellPoint is a managed care organization that services Medicaid members in Maryland. In the interest of time, I'm going to go ahead and turn it over to Lori so that she can present, and then we will turn it back over to Shakara. Thank you.
Good afternoon, everyone. I'm just going to share my screen really quick. Can everybody see my screen?
Not yet.
No, nope, not yet.
Can you see it now?
Yes.
Yes. Okay, great. So one of the things that I really wanted to talk about today is Maryland Medicaid renewal. As some of you know, that the COVID health emergency has ended, which means a lot of our Medicaid individuals will need to renew their benefits. I will send this flyer to Julia so that way she can share it with the group. But the first disenrollments took place yesterday. And so right now we are just reminding everybody to remind their clients that they need to renew their benefits. Renewal will not be automatic this year. And the reason why I want to bring this up is I know one of the things that you wanted us to talk about was our benefits. Well, if our members have not renewed their Medicaid program, then they want to have access to their benefits. And some of these benefits do include adult vision, which means they get to have an exams every year, and they also get eyeglasses or contact lenses every year. They do get over-the-counter drugs, which is up to $30 worth of over-the-counter drugs like pain relievers, cough syrup, every 3 months, and that's for each individual person in the family. They need a prescription. There is a $3 for a brand name, but there's no copay for generic drugs, and pregnant women and children under the age of 20 have no copays. One of the new things, we also have a 24-hour nurse helpline where members can call a 24-hour nurse helpline. That way they have questions without going to the emergency room. And some of our new value-added benefits that we added this year includes our Baby Essentials program, exercise and fitness, gas card, youth club membership, gym membership, fresh fruits and vegetables, and summer camp. And the members can actually contact member services to learn more about that program, and they will direct them on how they can actually apply for these benefits. So I'm going to go ahead and turn it over to the next person that's to speak for WellPoint.
Shakara, is she out there?
Hi, sorry everyone. I was trying to come off mute.
Okay.
I'm Shakara Kearns-Long with WellPoint, and I'm just going to piggyback off of what Lori provided. I'm going to share my screen. Give me 1 second. Can you all see my screen?
Not yet.
Okay. So basically, what Lori provided was.
Shakara,
Yes.
we can't see your screen yet. Were you still sharing?
Oh, I'm sorry. Yeah.
That's
Not
okay.
yet. And just to give you a little time warning, we only have about 2 minutes left, so if you can wrap it up in the next minute,
Sure,
that would be
no
appreciated so we
problem,
can close
no
out the call.
problem.
Thank
So
you.
basically, this is our quick reference guide for our providers. It gives the information and services that we provide, along with contact numbers for how to get authorization. This is on our website, the WellPoint website, under provider services. Basically, it goes over all of the services that we provide and the numbers and some of the certifications needed. So I will send this information out to you all so you can have this for our organization. Just keep it handy if you need any phone numbers or references of what our members are able to have accessibility to. This is a great reference guide to go to quickly. So, and if you have any questions, my contact information will be listed, and happy to assist with any provider needs. Thank you.
Great, thank you so much. And if you could just drop the link to that document in the chat, that would be great. And we can also we'll share everything out via the notes.
Absolutely.
Fine. Okay, so please drop any questions in the chat for the WellPoint team. We really appreciate it. Appreciate you sharing this information. And to all of our speakers and presenters today, I really appreciate the wealth of information that has been shared. It has been really, really valuable knowing about all of these incredible resources and services in the county. And I know we're at time, just about. So I'm gonna go, hopefully you guys can see my screen. But I just wanted to wrap things up really quickly and just point to the community announcements that we've listed in the agenda. So please do check those out. We don't have time to cover them in depth today, but Heaven has been helping curate this incredible list of resources and funding opportunities. So please do look into that. And again, we'll send it out via the notes. So this is all included here. And like I said at the beginning of the call, I'm just going to scroll up. Our next call is going to be a different schedule. So it will be on July 10th from 1 to 2:30 p.m. It's going to be a combined call with Montgomery County. We're going to be focusing that call on cold storage. So we'll be reaching out to presenters to join us for that call. So hopefully some of our cold storage trailer host sites are able to join and maybe present. So you'll probably be hearing from me in the coming weeks about that. So hopefully you can all join us then. Again, it's on July 10th, not our usual call schedule. We'll be sending out the notes and call information after this call. And I think that's it. I think we just got everything in time, maybe 1 minute over, but I really appreciate you being here. Again, thank you to our presenters, and stay tuned for the notes and the recording that we'll be sending out soon. I hope you all have a great rest of your day. Thanks so much for joining us. Bye now.
Bye.